Breastfeeding 101 by Senior Clerk Concepcion. This is me as a baby with my mama breastfeeding me in a cradle position. Breast milk is made for babies. It is the best food source to keep your babies healthy. Here are some of the benefits of breastfeeding. It gives all the energy and nutrients needed by the baby in the first 6 months of life, and it's all from you mommies. It also gives protection from illnesses. Hormones released during breastfeeding strengthens the bond of mother and child. Breastfeeding also uses up a lot of calories, helping mommies lose their pregnancy weight gain faster. Hormonal changes in breastfeeding also delays return to fertility. Women who breastfed also have lower risk for ovarian and breast cancer. Breastfeeding is still recommended during the COVID-19 pandemic. UNICEF recommends following health protocols of social distancing and wearing of masks for mommies. It is a mother's way of taking care of her baby, but it's important to take care of your health too. Here are some of the ways to take care of your breasts. Take daily baths or showers with mild soap and clear water, but only use clear running water on nipples. No need to wash before breastfeeding. Avoid tight-fitting clothes to make yourself comfortable. If you experience tenderness, it might be due to blocked ducts. Apply warm compress to alleviate the pain. Breastfeeding also prevents your breasts from being too full. You should also alternate sides to make sure both breasts are relieved. You can also massage your breast while breastfeeding to facilitate milk expression. Wear the appropriate underwear that would give support and help make breastfeeding more convenient. Breastfeeding is an expression of a mother's love and sacrifice. It is important to make it comfortable for both the mommy and the baby. You should be seated or lying down in a secure, comfortable chair or bed with your back adequately supported. Here are positions you can use. The cradle position is the most common. It holds the baby between the two forearms of the mother. Cross cradle uses one hand to hold the baby and the other to assist the latching. This is helpful for small or sick babies. The underarm position tucks the infant in one arm and its leg towards the mother's side. This is helpful for twin breastfeeding at the same time and for mommies with blocked ducts and difficulty latching the baby. The sideline is a good position when the mother wants to rest, like after delivery or at nighttime feeding. Breastfeeding is a baby's instinct, but they also need to check if they are properly latching. Here are the 4 signs of a good latch. The baby's mouth should be wide open to make sure the majority of the nipple is inside the mouth. More of the areola is seen above the baby's mouth. The baby's lower lip should also be turned outwards, with its chin touching the breast. Lastly, you need to recognize your baby's feeding cues. There are early, mid, and late feeding cues. For late feeding cues, you need to first calm the baby before feeding. Here are the references for this video. Remember, breast is always the best. Thank you, and please subscribe to my channel.